welcome once again to another edition of Good Books. I'm your host this week, Dr. John Cook, and with me today is Dr. Eleazar Kadile, who is the director of the Center for Integrative Medicine. He is a complementary alternative physician whose patients are the hard-to-lose obese with related medical conditions such as heart disease, hypertension, type 2 diabetes, arthritis, and psychiatric problems such as depression and ADHD. He has spent the last 25 years quietly developing what is arguably the greatest breakthrough in the battle against obesity, getting phenomenal results for hundreds of patients. The book is entitled Stop Dying Fat, Doctors Healing the Disease of Obesity. I like the title, Stop Dying Fat. In fact, it was that called my attention to it and made me ask for the book. Dr. Kadile, welcome to the program.
Thank you, sir. Thank you, doctor.
It's been very interesting to read through the KPP, the Kadiliatric Protocol Power Principle. But I want to start with your biography that you do at the end, because that's very telling about how you got into this work. So you have solid training in traditional medicine, but you moved into alternative medicine to save the lives of your children and your aging father. Let's talk about that for just a minute.
Sure.
So
you want me to?
Yeah. So you were educated at the Institute of Medicine in Philippines.
Yes.
Mm-hmm.
And I heard about how good the American medical education, so I took the examination to qualify to be able to train in this country, which I passed that.
Mm-hmm.
And so when I came to this country, I wanted to be a surgeon, and most of the surgeons that I followed, they were not happy of their specialty.
Mm-hmm.
Most of them have lost their family, lost their wife through divorce because of the demand and the intensity of being a surgeon. Of all the specialists where I interned, the happiest people with good, solid family were psychiatrists.
Uh-huh.
So that's how I switched my interest to psychiatry. So I interned in Independence, Iowa, and moved to Milwaukee, affiliated with Marquette University, and then I took my residency back to Iowa, and I observed that most of the psychiatric preoccupation was farm-related. Thinking from the Philippines, we have very few psychiatric disorder in the Philippines.
Mm-hmm.
In fact, Philippines is more than million population. We only have one mental hospital.
Uh-huh.
In United States, every county, we have a mental hospital. At the time, we didn't call it that way. We call it a home. Farm home to that effect.
Mm-hmm.
And every county have these home facilities for people with mental condition. So I moved my residency training to New York in Buffalo State. There I also noticed significant difference. The preoccupations of their mental concern is mostly city-related lifestyle, like they're hearing sirens, fire sirens, police sirens. In Iowa, they were so preoccupied about hearing cows and chickens, and also their delusion was all farm-related. So I began to question the environmental factor of illness. And then I realized that in my good training, most of the psychiatric referrals were chronic condition where conventional understanding was not there. The treatment for chronic condition was the same as acute care. it was through my question about this that led me to different forward-thinking doctors like Dr. Linus Pauling, Dr. Abraham Hopper from Canada, and they were thinking that schizophrenia was related to some deficiency of niacin.
Okay.
And then Linus Pauling also proposed that chronic illness, especially virus, was related to vitamin C deficiency. All right. Lo and behold, I was blessed by my older son, who at the time was 8 years old. He was very smart when he was a baby, and then grew up healthy. And by around 8 years old, I observed him to be losing weight. To make the story short, he developed one of the Thanksgiving Day a severe fever and vomiting. His pediatrician have no answer, so he advised us to bring our son to the Children's Hospital. I was already in Wisconsin, in Milwaukee. It was there after 3 days of diagnostic workup that his problem was systemic lupus. All right. So because of that, I did some extensive research. My wife is also have a medical background. We did it together. We could not find anything. We traveled the world. There was no treatment until somebody mentioned to me to consult a doctor, and we visited him in California. His name was Dr. Rapsomanikes. He was a Greek doctor. And he was initially in medical school. Like me, his sister was afflicted with some unknown medical condition, and she died. His father advised him, "Son, why wouldn't you stop your medical interest since they could not help your sister?" So he became a physicist. So it was him who introduced me to this other paradigm of medicine, which led me to his affiliation of the complementary alternative medicine. That's how I knew that is where I learned what I know now, that we do not have a good treatment for chronic condition. We continue to treat chronic condition like it is an acute, meaning all this is caused by an organism like a bug, bacteria, like a flu. So that's why most of our treatment modalities is called antibiotic, anti-life.
Right.
And this was the treatment that my son received, treated with mostly
anti-inflammatories for the symptoms of lupus and that sort of thing. Yeah.
Yeah, and he literally was dying in front of us. So not until Rapsomanikes introduced me some of the forward-thinking doctors, and we extended his life. He was able to go to college. He was supposed to, his life was expected only at the end of high school. So we stop all those anti-inflammatory, anti-immune treatment. Every month we will end up in children's hospital, and instead of getting better, he is worse.
Uh-huh.
So anyway, that's how I was led into doing this medicine now.
Yes, I was interested that you stabilized his condition using the complementary alternative approaches, and it did extend his life. You even were his kidney transplant donor, and he was lost to you at 22. Your daughter also developed lupus, and your wife was the donor for her kidney, but she's doing well and leading a productive life. And then with your father, there was this awful swollen leg, and you used chelation to remove the toxic metals from his body, recognizing that quite often it's not a condition that requires a bunch of pharmaceuticals to take care of issues, and that's evident in your approach to obesity. I think that one thing that is heartening here, for those of us that have done battle and done all kinds of exercise and diet programs, and that includes me, is the art of the KPP, the Kadiliatric Power Principle. And I think the thing that's most heartening is to understand that in many cases, diabetes is not in any way linked to how much you're eating or how much you exercise, that there are other causal factors that you're aware of because of the type of medicine that you practice.
Yes. What is the myth about obesity is this total embrace. You are obese, you are fat because you are too lazy to exercise and you eat too much.
Mm-hmm.
That is really a myth. That is a big American consumer insult.
Mm-hmm.
Eating too much and too lazy to exercise, in my many years of experience, is more of a consequence of obesity than the cause.
Mm-hmm. And in bold print in the first chapter, you say, "I will not blame you for having the disease of obesity. It's not your fault."
Yes.
I really think that would be a sign of hope to many people. You talk about the causes. It's a complex set of imbalances, and sometimes that's exacerbated by bad dietary choices, but there's also personal history, psychological patterns, social environmental factors that cause the disease of obesity.
You hit the nail on the head. Eventually, it becomes a social issue, and also because of misinformation.
Mm-hmm.
And then we embrace these things. For example, counting calories did not work. Mm-hmm. We have done this also myself. The new ways of choosing a food is the way we do it. We want to be sure that they do not have a hidden food allergy.
Mm-hmm.
A typical medical history, if a person grew up and when they were babies, they were not breastfed.
Mm-hmm.
If they were bottle fed, especially cow's milk, and there's two choices we have in this country, cow's milk or soy milk. Now, if you were bottle fed with cow's milk, you will eventually, not everybody, but majority will eventually develop a food allergy because the baby's digestive system is not yet mature.
Mm-hmm.
And if you feed this baby with cow's milk, one forget that cows have 4 stomachs. Cow's milk is hard to digest for humans.
Mm-hmm.
And then if you were bottle fed with soy is have 5 nutritional toxins. The most common, they are estrogenic. Majority of these girls, when they grow up, they will eventually have problem with their sex hormone, menstruation. They will develop polycystic kidney disease, which eventually will make one obese and will make one infertile, as well as they will have eventually develop type 2 diabetes. So these are an information available there, but the public are not aware.
Yeah.
So we do tests for the presence of food allergy. And many of these people, they have food allergy. They don't even know, so they keep on eating this food. So obviously, you get inflamed and you gain weight.
Mm-hmm.
And the most common food allergy are the common food we commonly eat in this country.
Yes.
Then we also do a thorough digestive system evaluation, because past the age of 40, most of these obese usually start around 20 years old, especially the new generation, because the food we eat now is mostly engineered, modified.
Mm-hmm.
And also it is loaded with toxin. So you have no defense. The food we eat is no longer the same food Mother Nature originally planted. It is modified to withstand a herbicide called Roundup.
Yes.
And there, in fact, there is such a thing as corn Roundup ready, soy Roundup ready.
Wow.
That means they plant these grains, they can spray Roundup, kill the surrounding weed, but the corn, the soy remains standing.
Mm-hmm. I didn't know that. That's interesting.
Yes, and then we eat this.
Mm-hmm.
Sure, we are not going to kill over, but that's how we have this increase of chronic diseases,
Mm-hmm.
like type 2 diabetes, obesity, because we are consuming food that have high levels of toxin.
Mm-hmm.
One forget that Roundup glyphosate was a nerve gas for nerve warfare.
Wow.
We use this in war.
Mm-hmm. Mm-hmm.
And they want to, since it is now confirmed that we're not supposed to use gas into war, so we have a lot of this. So Monsanto start to utilize this
Mm-hmm.
with the whole idea to feed the starving world. No, it's really for profit.
Sure.
The agribusiness was not developed for farmer to produce nutritious food.
Mm-hmm.
Agribusiness was to help farmer to have a lot of profit.
Okay.
So how can you blame these people? That's why I say it's not their fault, they are fat.
Mm-hmm.
In addition, I forgot now the organization, every year they meet these food scientists in a small town in England where all they do there is come up with scientific idea how to make human addicted to food. So one bite will make them more bite.
Yes.
They literally do this.
Mm-hmm. Yes, we've had a guest on our show talk about the big three, and that's sodium, fat, and sugar, and how together they create cravings, and they've loaded everything up that's processed with those kinds of things. So there's a craving to eat. There's pesticides. There's addiction, allergies, but there's also a lot of metals that we're consuming too, which create part of the problem, don't we?
Yes, I'm glad you mentioned about the metals, because one of the test procedure we do is to look at the presence of heavy metals. There is a hunger center in the hypothalamus that they just discovered not too long ago from people who smoke marijuana. Why? These people would have what they call marijuana munches. They become ravenously hungry. In fact, they call that hunger center from marijuana. They call it endocannabinoid.
Is that right?
Yeah. And this can be triggered by the presence of toxic metals. So when we have an extreme obese person who cannot stop from eating, they have this ravenous hunger, we usually order an analysis of toxic metals, blood and urine analysis. Majority of these individuals have high levels of toxic metals, mostly lead, mercury. Also, we get that from our colleagues in dentistry, as well as the industrial pollution for trucks and cars.
Sure. So there's a lot of things that are generating the cravings and the improper eating and the gaining of weight that don't have anything to do with willpower. But I want to take us through this KPP procedure because it's interesting, it's intensive, it can be challenging, I would assume, although I love the stories you've sprinkled throughout. One of them talked about looking like Jabba the Hutt. I really enjoyed that. But the first part is the testing, where we look at the blood and urine and stool and hair samples and check out all the kinds of possibilities there. But then we sort of get into the process with our doctor of figuring out how to, first of all, detox, and then through some rapid weight loss technologies or protocols, I should say, get to a point where we have a satisfying weight and then maintain. So, can you take us through the process that a patient goes through, recognizing that they are individualized, and we need to acknowledge that because everybody's different?
Yes, we have a basic diagnostic workup, mostly traditional. Number one, we want to evaluate for their comprehensive metabolic profile. And that includes looking at their glucose level, kidney function, electrolytes, liver, and gallbladder. We also have a questionnaire focus on question that would be a factor preventing them from losing weight successfully without exercise. One of them is their work habit. If they work night shift, we advise them not to do the program until they are able to change their work schedule. The reason being, normally, we are programmed by Mother Nature. We burn fat while we sleep.
Mm-hmm.
If you cannot sleep because of work, even though you sleep during the day, it's not the way it was designed. You got to sleep when the sun is down.
Mm-hmm.
And then you wake up when the sun is up. And one of the problems in our modern society, why we usually sleep late because we have modern light.
Mm-hmm.
So we have some questionnaire to help us if they can qualify, because we have to work with the way our body is designed. So that's number one. Then, as I mentioned earlier, a history of breastfeeding, that kind of thing. So then the next one that we will do a blood test is if they have a history of gallbladder surgery.
Mm-hmm.
And that's the most common surgery. When you don't have a gallbladder, you cannot be able to tolerate emulsify fatty, oily food.
Mm-hmm.
Therefore, one will be deficient of essential fat. And the body is composed of 70 trillion cells, and each cell is enveloped or separated by a phospholipids, which is made of essential fat. And many of us, I would even venture to estimate that 80 to 90% we Americans are very deficient of essential fatty acids. And the reason for that, again, is the agribusiness, because we harvest our food, both plant food and animal food, prematurely. So this food that we eat is so deficient of micronutrients. So we will analyze them for micronutrient deficiency, especially essential fatty acid, certain common B vitamins. We do that.
Mm-hmm.
So we also look at how well their pancreas function, because pancreas becomes overloaded with the kind of food available in the supermarket we buy. So we want to be sure that they have a good level of an enzyme for carbohydrate, as well as a good level of enzyme to help digest fat.
Mm-hmm.
Because the whole idea is you want to lose fat, not lose lean body mass.
Claire. Now, I've only got about 2 minutes left, maybe even less than that. So I'm going to have to speed up a little bit. Recognize that the KPP starts by rebalancing, and there's supplements, high quality supplements that are part of that, and replacing the foods that are not good for us with foods that are nutritious, and that's real important. Given what you've said about how we harvest foods and so forth. But the accelerated fat loss is kind of an interesting thing, and I've got about 1 minute. So can you talk about how HCG works for just a moment, please?
Okay. HCG works to help people not to feel hungry. They will only turbocharge metabolism for the first 10 days. Beyond that, they don't burn fat. It helps people comply because it will control. It's only one of the substances we give them to prevent them from becoming hungry. That's all.
Okay. And so if they're not hungry, they don't eat as much. And I know that at that stage, you got what seemed to me to be very small portions, but during that 28-day period and sometimes longer, people just have rapid weight loss, and yes. Then you have a food pyramid based on the KPP principle that
yes.
focuses on.
The last one that I'd like to, you didn't ask me this question, is to prevent them from burning lean body mass and muscle tone, is that after the first power principle 2, which is 26 days, we want them to go into Power Principle 3 where they eat more food to convince the body we don't have famine in the United States.
Right, yeah.
Because the body cannot recognize between famine and cutting back food for healthy reason.
Yes.
Once the body recognizes we have famine, the body stops burning food.
Yes.
Go into conservation.
We don't have time to finish. This is a book well worth reading. It's an interesting process. It's an application of a holistic approach, recognizing that obesity is caused by many factors, and we need to deal with all of those. We've been talking with Dr. Eleazar Kadile. The book is Stop Dying Fat. It's a good read. It's an easy read, and it's well worth your picking up. I'm your host, Dr. John Cook. Thanks for listening.